Hi, Jasmine. Thank you so much for meeting with us today. Are you able to tell us a little bit about yourself and the organization that you are a part of?
Yeah, hi. So I am Jasmine. I am a third year bio major here at UCLA. Um, and the organization that I'm going to be representing today is LCCM, and it stands for Latinos and Chicanos for Community Medicine. Um, and so, yeah, I'm a third year bio major. I came in as a bio major, and I've always just been interested in like health and working in like healthcare. That's always just had like an interest in, and especially not necessarily like well, especially working with like underserved communities and really just giving back to the community that's helped me grow. And just one way I can do that is through like healthcare. So that's a little bit about me and why I decided to like sort of join this org early on.
Awesome. Okay, so my first question for you is, what does being a member of LCCM typically look like?
Mhm. Yeah, so it's a really interesting org because it's basically LCCM itself is like the mother org, and then it has like various different projects within it. So members are technically considered like LCCMers, so we're all like part of like that org, and then everyone sort of like divides into like different branches. So when it comes to like meetings and everything, you attend like the general meeting, and then you sort of get like divide amongst all the different branches. So that's sort of like what a general meeting looks like. But apart from that, like being like a member means you like attend socials, and you attend like things, like workshops and like events in order to sort of get like the feel for what it is like being in healthcare, and also just like as a UCLA student and sort of just surrounding ourselves with like-minded people. So that's sort of like what the org stands for. Um, and yeah, it's a super interesting org, a super fun club that I like to be a part of. And it just helps you stay like motivated, like as a pre-med student, especially like for Latinos. Just because it definitely can get a little bit more intensive, but like being in like STEM, just it's a very like rigorous um, course load, and just you definitely like lack some resources along the way being like from an underserved community. So that sort of like helps ease that gap. As a member, you get like the resources and like the materials that you need to help yeah, to sort of help ease that gap and sort of ease you into things, and like it helps guide you. So like throughout your 4 years, you start off like as a participating member, and then you become like active as the more you like attend events and the more you like immerse yourself in like LCCM.
Awesome. Thank you so much. So the next question is, what makes LCCM different from the other pre-health organizations on campus?
Yeah, so sort of just to like expand again like the 4 different projects, we have 4 separate branches. So it's blades.org, lshp, and alma, and all those things sort of like, again, it's all centered around lccm, but it's super unique because each one of those projects focuses on like a specific thing. So for instance, blades is like the Black Latino AIDS project. .org is like donation of tissues and organs, so it like focuses on like bringing awareness to like transplants, and like it goes to like different like LAUSD schools and like brings awareness to that, and in our community as well. So we have like different, we go like on site, and we like yeah, just bring awareness, and we like there's like an annual walk as well that we participate in for like blades and for .org. LSHP is the one that I'm like sort of more involved in, and it's basically the Latino Student Health Project, and that one serves underserved communities in Tecate, Mexico. So we actually like travel to like Mexico, and there's like a clinic over there, and we take like hypertension readings and like diabetes. So it's definitely like that one is a little bit more like on site and like hands on. And then it's Alma is the last one, and that one is like aspire, learn, mentor, achieve. That's like what it stands for. And that when you go to like different schools, and like it sort of like exposes youth to like underrepresented and in underrepresented communities to like STEM education. So like we as members go and we like to like various like hands-on activities and like presentations and everything. And it's sort of just we just provide them with like resources and just general support, sort of like a mentor, um, and aid them in like their journey to like achieve like higher education. And it's just ultimately like helping them pursue like a career in STEM. And these are all like the schools that we go to for Blades, for .org, for all of these, they're all like local, and it all caters to like underserved populations. and we like go back to them. So it's like a yearly thing. So we get to know like the members, and we get to know like the 5-year-olds, the 7-year-olds that like have this like aspiration. And like we like say like, oh yeah, like I'm from like UCLA, you know, this is like a university, and we sort of like you know, help guide them. And it's definitely a super really nice way to give back to your community, because like um actually one of the like sites that like Alma goes to, it's my hometown. So like it's like one of the like elementary schools that I grew up nearby. I didn't go to there personally, but like I grew up nearby there. So like I know some of like my mom's friends have kids there. And like it's like super nice to like see that, like, you know, UCLA or like LCCM itself is going back to like these locations, or like my hometown, and like it's like emphasizing like careers in STEM to like Latinos. And even just like the Latino Student Health Project, that one is again is also um, one of the ones that I'm more like involved in, and that one again goes to like the Cat de Mexico, and it helps. We like work on site in order to help like reduce the risk of like chronic diseases, and just help general like promoting like health awareness within like those underserved communities. So we like go to like we like host like health fairs, like usually like every 3 months or so, so like 2 times like every quarter, um in like LA. And then we like make the trip to like the for to help like the Tecate community. So like hypertension, anemia, what else, like glucose, cholesterol, mammography, like we all do screenings for that. And so it's really helpful for us because we get like that like practice, and it really helps us like interact with patients, and like it helps us like just like develop those skills. But simultaneously we're also helping like underserved communities, and it's really like a bonus, because like we speak Spanish as well, so you get like that one-on-one connection, and you're like it's like that code you practice like cultural competency as well. So within just all those different branches, you sort of get to like experience different things, and you're not like just like restricted to like one thing. You know, you can be like you can explore things within LCCM. Like if you want to attend like an Alma project, or if you want to go into like LSHP, you're not like forced to just stay in like one branch. So you can like explore different things, and it's also like super like low commitment as well. You do things that you can like attend to, and things that like interest you. So it's also like it's open door, and it like welcomes everyone, and it's like it's like a super unique org that has like various different things. And I feel like not a lot of like orgs, especially like pre-med ones, like offer that much diversity across campus.
Awesome. Thank you so much. That sounds great. My next question for you is, what is one impactful personal experience you've had within LCCM?
Yeah, so for me, this is one of like my first events actually that I attended, and it was nothing like branch related. It was sort of just like an LCCM like internal event. So we have this as well, and it was like a Stop the Bleed certification. And I remember it was, I think, my second year. So like last year was one of like the first events that was like in person for me, and I went like alone. And it was sort of just like it was like a stop. It was like a certification, and it was like completely free and everything. I was like pretty nervous to go in, but basically we like learned how to like tie tourniquets, and we learned how to like pack a wound, and like how to like change like a dressing and everything, and we learned how to like triage. And so when they brought like they were like EMTs from yeah, they were like EMTs, and they like gave us like different like resources and things, and they gave us like little like tourniquet sets to like take home as well. But it was like super like impactful for me because it was the first time that I had ever like even learned. I didn't even know, like, first time I ever learned how to tie a tourniquet, first time I ever handled like medical materials. So and like I like everyone was like super welcoming. It was like a super packed space as well. So that was one of the things that like sort of like drew me back, because so we were like able to like get certified like right on the spot. We were able to like learn how to triage and everything, so it was like educational, informative. But I think really like what made it for me is just that like everyone there was just like super welcoming, and like the members themselves, a lot of them just like spoke Spanish like right away, like right off the bat, and that's something that I can relate to, and something that I like felt like, you know, was like really it for me. Just somewhere like where like, you know, it was like bilingual and everything. And everyone was just like super friendly, like with like all the like board members as well. So it was just like a very like well like executed event that like was, it's just like super like engraved in my memory.
Awesome. Okay. My last question for you is there an application process for LCCM? And if so, when are applications due and what does that application process kind of look like?
Yeah, so it's definitely so it's an open door org. So just the general application, quote unquote, is it's like a Google form, where you sort of just show like it's like an interest form, and the way like so you become like you can either be like an active or like a participatory member. So you fill out the Google form, you attend like the meetings. Usually they're like on Tuesdays around 6 p.m. And so the application process it's like an ongoing. So you can join like week 5, you can join week 8. So yeah, I just fill out the Google form, and again, it's like whatever you like come to, or like whatever like um you whatever like how many like workshops or things that you attend. That's where it like gives you like you either become like active or participatory, and so everything is like voluntary, and you sort of just you determine like whether you want to become like active or like participatory by attending like a site, or like by earning like an academic credit, so like like going to like study hours or something like that. That counts like as academic, or um like a social, attending like a social, all those things sort of like get you on the road to like active status. So really, if you just even if you do have like it's like low commitment, attending like the general meetings and like attending like site, as long as you attend, you are considered like participatory. So it's like a general, it's like a cool org, and it's definitely like one that like help makes you like stick around.
Awesome, sounds good. And is there anything else you'd like to add, Jasmine, before we end the mini interview?
Yeah, something that we also sort of do is that we have like an annual like pre-health conference. And that's like open to like all students regardless of like major or anything. And it gets like huge because various different orgs are like welcome to like table and everything, and like physicians come talk to us, and like just the general people in healthcare. So like it's like yeah, it's like a pretty big like pre-health conference, and it's annual. So if you're like anyone is like ever interested, it usually happens in like spring quarter. And it's just a great opportunity to like network and everything, and it just helps promote like awareness of like STEM culture as well. So it's that I'm sorry, of like Latino culture. So it's something that like you me as a student can like look forward to, and like other students as well if they want to like ever check it out.
Awesome. Well, thank you so much, Jasmine, for meeting with us today. We really appreciate your time.
Thank you so much, Kimia, for letting me like talk to you about like LCCM.
Of course.